Thanks everybody for joining us this afternoon. We are very excited to officially release Barcode Reader integrated with NextGen. This is really our first session. We introduced it at UGM last fall, and there's been just a ton of work between our organization and NextGen to get us to this point that we're at today. We're excited to give you an update on where we are, as well as talk about the release cycle and what that's going to look like starting today as it moves through this fall and towards UGM. So just to get started, would like to first start with just telling you a little bit about us and who we are. So today, again, I'm Craig Luce. I'm the president here of EHR Integration Services, and I'm going to take you through a little bit about who we are, and we're a little bit new to the NextGen space, so get you a little introduction of who we are, talk a little bit about the product, and then I'm going to turn it over to Rochelle Herbert, who is one of our solution specialists, and Rochelle is Miss Barcode. She is going to take you through the product start to finish, show you very interactive how it works currently as we're connected into the NextGen sandbox area. So again, just quick agenda. Once we're done with the demo, we're going to talk a little bit about what's coming up, right? So we have a product that's ready and is being released as we speak. We have some new features that are coming up here very, very soon this fall, as well as new modules planned as we continue to move out. So we're going to take some time talking about what's coming up, and then as Michelle said, we'll move into a Q&A session and open up the phone lines. So again, just real briefly on who we are, EHR Integration. Our focus since we began the business about 13 years ago is really looking at what we call the human approach to healthcare, and really looking at workflows and technologies and how they all integrate together. And of course, that sounds pretty simple and straightforward, but we have found that no matter where we go from practice to practice, it's amazing. Really some simple tweaks and changes from workflows can lead to huge efficiencies. Sometimes those workflow changes are electronic, sometimes they're human, sometimes it's a combination of both. And again, today the barcode reader application is going to be a great example of where it's really a slight introduction of technology that we're all familiar with. Barcode readers are used obviously in grocery stores and everywhere, and if you ever are in a hospital, actually scanning vials and so on. This is not new technology. It's really just getting it introduced into the workflow in the ambulatory space, and that's our focus. That's what we're going to be talking about, and again, that's really the focus of our group in general. Again, real short history on us from a organization perspective. Although we're newer to the NextGen client base, last year was our first UGM that we attended. We have been in business for 13 years. Our initial focus was on the Allscripts and IDX or GE healthcare space. And that's really where we've spent probably the past 10 to 12 years, or our first 10 to 12 years. Around year 11 or so, we really started expanding our focus, diversifying across other spaces. And in the NextGen space, we became a natural strategic partner with NextGen because of their acquisition of Eagle Dream Health. We have been a long-time strategic partner with Eagle Dream Health since that company's inception. And again, it really made us a natural partner with NextGen, not only in that space, but understanding what we've done in the API development space across other vendors and other organizations, and what we might be able to do here. So that really is our focus, and we truly look forward to meeting and really getting involved with the NextGen users and moving things forward. We provide a variety of services across the practice continuum, as you see here. Today, like I said, we're really going to stay focused on the clinical workflow. We're going to take a look at the barcode reader application. Our website is full of other information that you can read about us, but just to stay really honed in, we're going to be looking at barcode today. So again, we're going to take a look at the background of it. We're going to talk about some client successes. Although the integration into NextGen is new, this is not a new application. So we really want to take you through the journey that we've been on and show you a demonstration. And really, to start it all off, I wanted to highlight Murfreesboro Medical. Murfreesboro has been a longtime client and friend of ours for many, many years. They happen to use the Allscripts TouchWorks EHR, but I highlight them because not only are they a great user of Barcode Reader, they're actually the reason why Barcode Reader exists. And from an inception perspective, Dr. Nick Cote, who's now their Chief Medical Informatics Officer, he approached our organization back in 2014 and really was looking to have an application created, in his words, to get his nurses back. That's how he presented it to us. He was truly sick of the time that his nurses were spending on data entry, all the clicks and all of the manual typing that needed to be done for every shot that was given in his clinic. He is obviously a practicing physician as well as the CMIO. He went on to tell us that the data entry was often hurried, obviously leading to errors and incompleteness. He had issues with billing anytime afterwards from a research perspective. If they needed to research perhaps a medication recall or something by lot number, they found just many different areas of human entry issues. And so with that, he came to us and said, I'd really like to have this application that could help answer some of these problems. So to be honest with you, we created a very custom application specific to his workflows and what they were looking for. And, again, as often happens, people talk to each other, right? Organizations go to user conferences and so on, and they start sharing, what they have going on. And, of course, with Dr. Cote, frankly, he was pretty proud at what he came up with and said, here's the problem we solved. And based upon that problem, we had many other clients contacting us. And honestly, shortly after that, we commercialized the product, really standardizing the product itself, its installation, its support processes. As you can imagine, taking a custom application to make it a commercial application, it's not an overnight process. But through that process, we were able to learn a lot across other clients and their specific workflows, and really standardize, again, what it is that we were delivering. And with that, I like to say, again, the application Barcode Reader, it was born. So from there, we go on to where we are today. So again, it was actually in early 2015 that we completed that transition to go from a custom application to a commercial-based application. As it says here, it was first released into the Allscripts TouchWorks EHR. Have 20+ organizations using it of a wide variety of sizes. Our largest user, we do run transactional reports, as you'll see us talk about here throughout the presentation. And our largest user last year delivered over 100,000 medications with the scanning and the process that Rochelle is going to take you through. So we're very excited about the application, and again, in the end of the day, hopefully saving you time, energy, and money by providing you a much more efficient way to document and process. So that's what we like to say, saving clicks saves time, right? So that's really been our focus. We have done some time and efficiency studies across our clients, not only by polling them and asking specific information on how things have worked, whether it be delivering the actual immunization or medication, to, again, correcting the data entry in how that process works. We've taken that information, we've compared it against the data, the actual transactions that they've put into the system. And what we're finding here, as you see on the screen, is that we're seeing roughly a 33% increase in immunizations. And as you can see here, it says it saves about 4.5 minutes per immunization. The key part to this is not to think that it takes you 4.5 minutes to deliver an immunization, right? We know that's not the case, but it's really looking at the efficiencies that are realized across the entire vertical of the process. So whether that is what we have focused here on better documentation, correctly placing the 0 for an NDC for anyone that is familiar as we're recording that for medication administration. Making sure that the NDCs are formatted correctly is extremely important for a wide variety of reasons. Easier and quicker data entry, right? Again, the goal is to save you clicks so that you're not touching your keyboard, so you're not touching your mouse, and you're doing everything you can from a scanning perspective. And then where we see the most time saved is on the time that you have to do that research for that recalled med, or perhaps a shot that was given incorrectly based upon the medical record documentation. And by ensuring that the documentation is pristine, the time and energy that is saved on the research is really where we're seeing that efficiency across the vertical. Just another highlight here of one of our client successes in North Bend. I like to really highlight North Bend Medical, and as you can see here, as Michelle said, we'll be following up with this recording afterwards, and each one of these client success stories actually has a video specific to them embedded here within the presentation that you'll receive. So you can see it in their own words on what the application has done for their organization. But not only is North Bend one of our strongest users of the application, but what was really fantastic is they knew what they wanted right out of the gate. They knew, if you read through some of the quotes here from Julie, they knew they had a real human data entry error issue. They were seeing it every day, having issue reading the tiny print on the vials, making sure the NDCs were actually formatted correctly. And at one point, she actually says that ensuring the NDCs were entered correctly was actually a losing battle. And so by the introduction of the barcode reader application, not only have we made from an efficiency perspective a simpler process for them, but likely, and what she really highlighted the most, was raising their organization in Oregon to what is called the gold status in the Oregon Alert System, which is ensuring 95% or more accuracy with the data that they are submitting, specifically around NDC and lot numbers. So again, that's just an example of what the product can do for you. And as you can see here, the theme of what I keep saying is efficiency, right? This application is about making your organization more efficient, but it's not just about the delivery of the actual immunization or medication, but of the overall process in general. However, with that said, delivering the immunization is also equally as important to make it efficient. And as you can see here on the screen, we take you through basically a 4-step process where you're going to actually be choosing the immunization from the list of the current ordered. You're going to scan the vial. So once that scanner hits your hand, our goal is that you'll never set down the scanner. So you'll scan the vial to bring in certain information into the application. Then we'll have an additional scan sheet that is specific to your organization with very specific barcodes on it that Rochelle will take you through. And then even instead of clicking the Save and Continue button in our application, we have a barcode that will do that for you. So again, overall goal is the scanner never leaves your hand unless the nurse, of course, is actually providing the actual immunization into the patient. And then once they're done, they're going to pick that scanner back up. So with that, I'd like to turn it over to Rochelle, have you take you through the application where it stands today, and then we'll talk about what's coming up in the near future. Michelle, you want to switch it over to Rochelle?
Yep. Does everybody see my screen? Can everybody hear me?
Fantastic. It is up and we hear you, Rochelle.
Perfect. Okie dokie. So like Craig mentioned, I'm going to actually run through the NextGen software and how easy the process of scanning in those barcodes actually becomes. And it really enhances and streamlines your workflow every single day by the efficiencies it makes through just using the scanner. So I'm showing you just a test patient within our sandbox. So you can see here, I have a couple orders. The ordering process in itself is going to remain the same way from NextGen. And so I'll use this varicella as my example today. So you can see that I have a pending order. I have that sitting out there, but there's no administrative data sitting on that yet. So traditional would be you're going to go in, you're going to manually look at that tiny little vial, you're going to put in all those different requirements for lot, manufacturer, etc. And so, like Craig said, we are just going to take a lot of those away by using the barcodes right in front of us or on the vial itself. So after the order has been placed, you'll use this template, as I'm sure most of you guys are familiar with, and you'll actually go launch over to this barcode app. So as this launches, oops, I have another one open, my bad. So as this launches here, you're going to see that those same orders that I just had showing are actually up and right available for you to actually click and finish out that and complete that order. So the varicella is the one that I just talked about. So as you click through that varicella, it's actually going to open up a screen that has those same items within. I'll explain this screen kind of step by step, and then I'll run through one more to show how quick and easy it can be. So the amounts here, this is a screen you can either choose to type in that specific amount or use a barcode. I know there's some variants too, like if you were going to do a flu vaccine that you need 0.25 instead of the 0.5 full dose. For those reasons, we have just left that so you can either scan a barcode or actually type that in. Down here on this screen, the scanner area, this is our key area to get all of that barcode knowledge into. So as I pick up that individual vial and I go to scan in my varicella, I click there and you're going to see a couple things just happen. So it automatically added my lot number, it automatically added my NDC number, and it automatically put my expiration there. So all of that comes into play. I'm going to go back to that scanner box. I'm going to magically click in that says I need my milliliters to also show that's 0.5 milliliters. I need my manufacturer to come in there. And so now that that manufacturer goes in there, Craig also mentioned the ability for it to check and make sure that NDC number had the right zero in the right position. So as most people know, NDC numbers on medications or immunizations only contain 10 digits. For billing purposes, they need to contain 11 digits. And so therefore, every single NDC number has a different pattern scheme on it. Merck happens to be a 442 pattern. Therefore, that zero is going to stay in that same first position. If it was a 532 pattern, that might go in the 6th or the 10th, depending on where that goes. So we're taking that, oh, shoot, where does that go? I know I have to get to 11 out of that whole process so that we can guarantee that that information is stored correctly. Let's come back over here to my scanner box. Like Craig said too, we have different scanners and areas that you can put within. So I just scanned in the route to show that I am now. I'm going to scan in the left thigh. And at this point, if you choose, you can always type in a strength or a brand. It's kind of up to you whether you want to put those in. Those are fields within your NextGen. So if you utilize those, you can type within those. If there's something that a barcode didn't get created so that you don't have to pick up that mouse, ideally that's what we would do as well. A little bit more just about the screen. You're going to see that obviously the name of the drug comes right across the top. It links to the same encounter. So I have all these encounters over here linked to that 8-7 encounter. It's linking all of that information in the exact same way. It's also saying what provider ordered that immunization. And then I, as a user, I'm logged in as the sandbox user. So we're actually capturing, hey, Rochelle admin, or sandbox UGM, was who actually did that administration. So we're capturing all that to a log file in the background as well. One thing just to add that I like to say, and I'll go through this whole process without as much talking here in a second. If you found out that, oh shoot, we just switched that and now we're using Pfizer instead, you always have the capability to drop down and adjust a manufacturer, a route, etc. So you're going to see all your different options. Again, we wanted to take those clicks away. We wanted just the simplicity of clicking that barcode. So I'm going to go ahead and I'm going to hit save and continue using a barcode. So I'm going to click on it. And it's going to bring up the next one within my list. I think it is here. We'll let it go in my MMR. So again, without as much talking now, I'm just going to run through that same exact process that you just saw here. Scanning in my milliliters. Scanning in my manufacturer. Scanning in my vial. Scanning in my left eye, my IM. And again, you'll see that no particular order. You can scan those in whatever order you want. And then I'm going to click save. Once that actually all completes here then, you're going to see that once I hit save, I already have those 2 orders that have been removed. So that completed that process, as well as I had 2 orders yet that I haven't done. So it's kind of just always talking through that API back and forth through NextGen, so everything can be documented correctly. And so now I'm going to actually pop over to the orders module and just do a quick refresh. So varicella was just pending. That was one that I just scanned in. And you're going to see down here now that all of that lot, expiration, manufacturer, route, all of that was entered, as well as who entered it, where it was entered, etc. If I go to my MMR just to show this as well, so same exact thing, all that information was entered. So easy steps, easy process, definitely takes the small vial viewing and everything out of that way by just using the barcode scanners. So I'll turn it back over to Craig.
Fantastic. Thanks, Rochelle. And I will just wait for the screen to get passed back over to me. There we go. All right, we're back in business. So fantastic. So that is the application that exists today. As you could tell, very focused on immunizations. That was our initial release. We broke the application up into 3 major modules: the immunization module, the medication administration or the med admin module, as well as looking at the inventory module specific to particular integration points with the NextGen inventory module as well. So the first release, as you can see, is ready and is already currently being deployed with immunizations itself. Coming up next is going to be MedAdmin. That's going to be available here in the fall of 2019, literally in the next couple of months. We're in the middle of developing and testing that application right now. So it's going to have a lot of the same functionality as you just saw from an immunization perspective, and that ability to scan in all the appropriate documentation, do the NDC code reconciliation as Rochelle did such a great job explaining. We also realized as part of this process, again, it's just continually evaluating our application, that we needed to do a little bit more work on the back end and middleware, specifically around upgrading to some of the latest frameworks based upon some API changes, just really optimizing the architecture structure overall. We're constantly looking to improve our auditing, our logging capabilities, and obviously security in and of itself. So as part of the MedAdmin release that you're going to see coming up, this is all been a focus of the development team and is all getting packaged together. Also as part of that is a brand new UI refresh. So from a user interface perspective, as you can see here, What Rochelle showed you was showing you the immunization list, this area right here, and a listing of the immunizations. And then once you clicked on the immunization, it brought you to a different screen. We've heard feedback from our current client base, as well as just looking at the product constantly over and over again ourselves, in that we needed to optimize our own workflow, right? We can be even more efficient in our own application itself. And so we have this major redesign that we're doing right here. And so this is a screenshot of what the up and coming application is, a proximity of what it's going to look like. It's going to increase your speed and your user experience, right? So not only from an upgrade in the framework perspective behind the scenes to increase the overall speed of the application itself inherently just showing you everything on one screen is definitely going to really optimize your workflow. On the initial load, you're going to see that it's going to populate the left-hand menu over here. This is going to be configurable on whether you see immunizations, MedAdmin, or both. Then once you have selected a particular immunization, as you can see here, the first one is selected, you're going to go through the scanning process exactly the same way as Rochelle had highlighted to you, by having your cursor here in the scanner box and clicking the actual scanner is going to work your way right through the process. When you go to hit the save button, it's going to do some validation on the screen itself. Is the NDC in an appropriate format based upon the manufacturer that you have selected? Are all your required fields actually filled in? It's not going to allow you to leave the screen without doing some validation, some data validation itself. And then once you actually do complete that item, instead of taking you back to another screen, you're going to actually just see it disappear here from the left-hand side of the screen. So again, think of this as a task list, if you will, and knowing you have 6 things to deliver potentially here, you're never going to leave the screen. It's all going to be done here as you work through one by one by one. So again, we're very, very excited about the upcoming and improved user interface. That too is going to be delivered on or about the same time as medication administration. So again, all of this, as you can see, we have a lot that not only we're releasing today and that we have already in motion, but really excited about what's coming up in the next couple of months as we move forward with the application. And then on the inventory module side, first of all, we simply wanted to acknowledge that there is a lot of interest from the clients on how we can actually help in integrating and potentially reconciling with the NextGen inventory module. With that, this is still in our long-term scope, and as it says here, there is more design and actually more client input that we really need. What are the problems we're looking to solve? Where are the pain points in the NextGen inventory module, and how can we help? So we're going to be pulling for more of that information. If you want to be involved with that, you're going to see some contact information at the end. We'd love to have your input. And honestly, NextGen would love to have your input. We want to work together between our organizations and really look at how we can help solve what the specific needs are. And as it stands today, we've heard of a wide variety of issues in problem areas, if you will, of how we could make that overall process more efficient. So although that's still in our focus, short term right now, initial release of the application, what we will be providing is a monthly transactional data report. So think of it as an Excel spreadsheet, everything de-identified. Every time you scan a vial and scan the information, as Rochelle showed it to you there, we'll be logging that. So if you're doing some via our scanner application and other immunizations and medications, once that's available manually, if you will, without our scanner application, we're going to provide you back that data that you are actually using our application with, so that you can use this spreadsheet to help with the reconciliation process. And again, part of the feedback we've heard is that just that process itself can potentially ease some of the reconciliation that you're dealing with today. So that's what we're starting with right out of the gate, because we have that information available to us. So why not give it right back to you so that you can use it for your needs? Again, just to be very, very clear, when we provide that, it is totally de-identified. No patient information is along with it. We're simply going to show you that this particular vaccination was given, lot number, administered by, and so on, and the date that it is. So very specific to that vaccination, but no information about the patient itself. And then the last but not least, of course, is the age-old question is, so how do I get this? What do I do next? And what's the cost going to look like for me? So from a pricing perspective, we have heard a lot as we've had many conversations, not only with the NextGen client base, but other EHR client bases. And traditionally, we have sold this application based upon provider. And, you know, the real feedback that we've received is that it's a very difficult variable to measure against when I do this based on provider from a pricing perspective. But what is a very straightforward variable to measure against is the transaction. How much do you use the application? Right? And when you use it, that's when you should be paying for it. So that is really the model that we've moved to. Again, received a lot of feedback at UGM last year, and we've rolled that into our sales process. As part of our sales process, we will create for you a personalized return on investment or an ROI document. We're actually going to ask for a little bit of your assistance. It's going to take typically 15 minutes or less. We have some very standardized NextGen scripts that we will ask for you to run against your database. And what we're doing is we're actually collecting last year's data. We want to look at what you did last year from an immunization and a med administration perspective so that we can create a very personal return on investment document based upon the usage that you showed and displayed last year. So the interpretation is that you're going to do the same potentially or thereabouts this year. We're going to plug that into the document. We're going to base your contract based upon that transactional usage so that you can see all of that together. What we have found through the efficiency studies that we've done, the feedback that we've heard, comparing that into all of the costs that are associated with this, not just your nurse's wage and benefits and so on, of physically delivering the actual medication or immunization, but also the research costs and so on. There's some national standards that we can use to compare against this. And so far, for about the past 4 years, as we've done these with our clients, we're seeing roughly a 33% efficiency gain across the line. So we'll actually create you your own ROI document that would show you if you use the application and you had a 30% efficiency gain, how, you know, again, what the cost of the application is going to be and how quickly it would pay for itself. And then honestly, we bring the bar down even further and say, what if you just gained 10 or 20% efficiency? Right? If we just gain 10 or 20% efficiency, our average is 33%, which tells you that we have people that are seeing greater efficiency than that, and obviously some that are less. But let's bring it down to maybe 10 or 20%. What would that look like from a dollars and cents perspective? The great news is what we're seeing is at a 30% efficiency gain, most people are seeing that the application pays for itself in about 6 months or less. And if we bring that down to 20%, it takes roughly 9 months to a year, depending upon your usage, where the product actually pays for itself. And then from there, of course, you're only saving more and more. So again, we like to arm you with as much information as you can. And so as part of that process, a part of the sales process, excuse me, like I said, we're going to ask for just a little bit of your help. But I think that little bit of help will go a long ways in really helping you frame this up as an application for your organization. Thanks again for your great attention and spending an hour with us. Hopefully we've been able to answer the questions that you had. Should anything come up, again, you're going to hear from Michelle, you're going to hear from Stacy. Please reach out to any of us. Rochelle and my contact information will be in there as well. Thank you again for spending the time, and have a great day.